My name is David Shimp, and I am the Chief Operating Officer of OU Medical Center. I also have the privilege of being the Administrative Officer over the Oklahoma Transplant Center. It was just over a year ago that we ended up creating the Oklahoma Transplant Center, and transplants really end up being the stuff of miracles, and it's with that vein that we're here to celebrate today. It's not every day, in fact, never in the history of the state have we done 4 pediatric transplants in the course of a single day. Those 4 kids, those 4 lives that were changed, represent 4 of the 23 patients that we have so far transplanted, both kidneys and livers, so far this year. Really, none of this could be done without the extraordinary team of physicians, nurses, transplant personnel that make all this happen. And with that, I'd like to turn it over to Dr. Puneet Sindhwani, who is the Surgical Director of the Pediatric and Adult Renal Transplant Program here at OU.
Thank you, David. Hello, everyone. First of all, I want to thank everybody who is here, especially the patients' families, and the team effort that went into getting these transplants done. Starting Friday, we started getting the calls. There were some very good donors that were available, and one after the other, as we say in transplant, when it rains, it pours. And Jeremiah and Mani did an extraordinary job of getting all the organ offers done in timely fashion. These are good kidneys, and despite one after the other, we had all the calls squared up. We got the patients in timely fashion. We made sure that they were all available in good health, and we got the transplant process started. It all started on Saturday morning at 5 a.m., and since there were 4 kidneys available, that had to be done. And as it had to be done in a very expeditious manner, we had to mobilize all our resources, and it takes a team to do all those 4 transplants in a span of 12 hours. I had to ask my colleagues, my friends, everybody to come in. Dr. Heinlein, my resident, started the whole process, getting the patients admitted, and we all got the paperwork done in the process very quickly. Dr. Kropp, who was not even on call, very kindly, graciously pitched in, came in, and got the 2 transplants started. We had 2 rooms going on at the same time. To get the 3rd transplant started so that it overlaps, Dr. Culkin came in, pitched in, and we had the 3rd transplant started by the time the 2nd one was finishing. By overlapping this way, we cut down the time for which the kidneys were on ice. And thanks to that, all these kidneys started making urine right on the table. And there's nothing more heartwarming to me than that. We had the kidneys done by the time we were 5 p.m. or 6 p.m. So at the end of all that, the biggest thing was to see the grins and smile on families' faces and the children's faces. I walk into Taylor's room, and the first thing I asked Taylor next day was, so what do you want for your food? And the first thing he said was, I want cheeseburgers, because I haven't had it in 5 years, so I want all cheeseburgers. So those are the kind of, I think, best rewards that one works for. And in the process, I want to thank everybody. I really am thankful to Anesthesia, who mobilized all their backup teams. They got everybody in timely fashion, OR staff, OR schedule, our scrub nurses, scrub techs, and Blake Palmer, our fellow in pediatric urology, who did an extraordinary job of getting all this started and going at the same time. And I think I'm just thankful in general, all the resources that are available to us. Thank you, David, for making these available to us. And I want to thank Dr. Henry, and we kept him all night up, despite being so tired. He was so gracious to be there, look at the kids, make sure they were ready to be transplanted. Thank you very much.
No, I mean, Dr. Sindhwani, since his coming here and starting the addition of the renal transplant to urology and the participation, pediatric urology has always been an integral part of the transplant program, and we just are happy to support you and your efforts. But it's only through your dedication that we were able to mobilize, and thankfully from anesthesia standpoint and our nurses and the close collaborations we have at Children's Hospital, this feat was able to be done. But it was really through your efforts and the dedication that you have towards the transplant program that we all felt indebted to you. So, I mean, that's why it all happened. So it was you that made it happen. So, Are there any questions?
Can you talk a little bit about I know you talked a little bit about the coordination and the team. Give us some idea of how large that team actually was. I mean, how many people does it take to accomplish something like this?
Absolutely. It's a big team effort. And if I start counting, the first person that takes is transplant coordinator who takes the call. And this all process started the night of Friday. So Thursday, Friday night in between, that's when we started getting the offers. So my coordinator, Jeremiah, was actually up with those offers starting Friday night. So starting with the coordinator, then the clinic manager took over, and then after that, a transplant nephrologist looks at the patient. Then they give us the okay to tell us that medically the child is okay to proceed. And next is the resident who comes in, gets all the workup done. So that's where Dr. Heinlein came in. And then I came in to evaluate the patients after that, looking at the overall picture to see if the organ is a good match for the child, given the circumstances we are in. After you look at that, then the operating room schedule starts. It being a weekend, you have to call the nursing floor, nursing manager. The anesthesia teams are mobilized because now you have potentially 3 to 4 rooms going at the same time. And not only do you require anesthesia, you need anesthesia techs, anesthesia support, then the operating room personnel, including the scrub techs and the circulators which go in there, and all the staff that goes with it, including transportation. So every piece has to be in its place so that it works like a well-oiled machine, and it did. And we are very proud and very thankful for that. So to answer your question, if you're looking for a number, probably for each transplant, won't you say maybe 9 or 10 people each transplant that were involved in each aspect of that. And I forgot the post-anesthesia recovery, the ICU beds that are arranged afterwards, and the nurses who look after them one-to-one afterwards. So I don't want to miss anybody and belittle anybody's work, but it's hard work, and it requires sweat and effort, and it has to be in place ahead of time so that the protocols are all there, and that's where OTC vision comes in. And the Oklahoma Transplant Center has been working towards that vision so that we are the premium place for all these kids so that we can help them in a timely fashion.
How are all of the patients doing now?
Eating cheeseburgers still? Okay. They're doing very well. They're all on regular diet. They're all slated to be discharged tomorrow. And now most of them are walking around. And one person already has been outside walking. And their families are here, happy, grinning. Pain is under good control. And so far, very good. Ms. Johnson.
First of all, I don't think I can say enough about the team and the Oklahoma Transplant Center. We are very grateful, and we're still excited about the news that we received on Friday. When Monty called my house, I started screaming almost. And my son was wondering, he said, "Why are you screaming so early in the morning?" I said, "They found a kidney. We got a kidney." He said, "Really, really?" I said, "Yes, we found a kidney." And so we were so excited. Everybody was excited in the house. And so I went to work and I told everyone that we had received a kidney, and I got a lot of hugs and a lot of congratulations and everything. And so I want to tell other families, I want to give back and tell other people, you really don't know what your fate is in life. And so if you haven't signed the organ donor card, I want to say to everyone who can hear my voice, you need to go and sign an organ donor card and give back. That is something very precious that you can give back to other people. And so I just want to thank everyone that is seated up here, and Dr. Zimwani. I want to thank him especially, and Monty for the call. I thank you for the call. And we're still turning flips inside, and we're still excited. And thank you so much for the gift of life, the gift that you've given to our family. We really appreciate it. Thank you so much.
Thank you, Ms. Johnson. Whenever a kidney offers comes through, it's a very bittersweet time. You hear the story of the donor, and it's a sad moment. But at the same time, you find the positive in that that a family made a brave decision during probably some of the toughest hours in their life to be able to make that brave decision to donate the organs of their loved one. And that's what Ms. Johnson just touched upon, and I'm really thankful. And to see that how those donors and their organs change so many different lives, and how the life continues, so to speak, in one way or the other when the organ continues to live in some other body. It's always a miracle of life, and it's not unusual when the kidney reperfused and turns pink that the residents or the students who are with you they can still see, yes, kidney's pink. And you always have that warm feeling inside to see a so-called dead organ come to life again. It's a wonderful feeling. And once again, we want to thank the families who made this gracious and wonderful decision in donating organs of their loved ones. And I can just assure them that they were put to good use, and many of the lives have been touched and will be changed forever because of their decision. Dr. Henry?
I'd like just to reiterate what Dr. Sinwani said about the impact it makes on the family, more especially the kids themselves. Long-term kidney disease has a huge impact on the child's activity, how they grow and how they feel, and they're not ready yet for the energy and the things that these kids are going to start showing them again. That's going to be a huge surprise to them that we always get to hear later on in the weeks to come. So it's a pleasure to be part of this event, and congratulations.